Hi, this is Dr. Heffelfinger, Jefferson Facial Plastics. I'm going to do just a short video on for you today, basically about updates in facelifting. So I gave a lecture recently at the Wills Eye Cosmetic Conference. I'm at Jefferson Hospital here in Philadelphia. We're closely affiliated with the Wills Eye Hospital and have very excellent colleagues in the oculoplastics department. I was honored to be one of the guest speakers to talk about updates in facelifting. So, as far as updates in facelifting, what's new nowadays, it wasn't happening 5 years ago. Well, the trends in facelift surgery at this point are for, number one, shorter scars. So nobody wants the long scar that goes up into the temple area, that pulls your hairline back, that extends really far back on the back of your head, that can cause alopecia or hair loss in that area. So what we're trying to do is keep the scars shorter, but have the same effects from the facelift. And there are many techniques that people have developed. I think that I've put together my own technique from reading multiple sources, going to meetings, performing many of these surgeries, and that I give a great result with a short scar technique that can give you very long-lasting results. So one is the shorter scars. Two is that more and more people are electing to do procedures in the office. So if you're thinking about a facelift, you're well aware that the costs have to do with anesthesia, facility fees, and surgeon fees. So doing them in the office under local anesthesia is a way to cut down on some of those fees. The other thing it does, you're awake during the procedure, and there's some thought that you bleed less, your blood pressure is less labile, and that your recovery is quicker when you do it under local anesthesia. So that would definitely be trend number two, is that patients are electing more and more to do these procedures in the office. And our facility here, we have our own dedicated procedure room. This is a tertiary care medical facility, and we're very careful with patient care. So although it's under local anesthesia, we are not compromising patient safety when we're doing these kind of things. So that's number two. Number three is earlier facelifts. So there's a study that came out recently looking at 3 different cohorts of patients, and they took age groups of people under 50 years old, ages 50 to 60 years old, and then over 60 years old. And I bet you can't guess what they found as far as patient satisfaction goes. So if you had to pick a group that was the most satisfied after their facelift, would it be the younger crowd that's less than 50? Would it be the 50 to 60 year old range, or would it be the over 60 year old range? I'm going to wait to tell you the answer for a second. People come to me all the time thinking about facelift surgery and saying, "Doc, is it time? Am I bad enough where I need a facelift?" The results of this study have proven that that is not the question to be asking. So, I don't think there is a right or wrong time, or that there's a certain amount of facial aging that you have that triggers the point where you absolutely need a facelift. The results of this study showed that the patients that were most satisfied, both in the short and long term, and the ones that looked better, both in the short and long term, were the ones under 50 years old. So patients that have facelifts in their 40s. You might think this is crazy by hearing this, but if you think about this, it's much easier to maintain something than it is to reverse it completely. So, in your car, for example, you're changing your oil, you're maintaining it on a monthly to bi-monthly basis. It's much easier to keep that in good shape and in a new car condition than it is to let it go for 6 years and then think that you're going to reverse the whole thing. So that's the thinking behind this. So the younger facelift is definitely a trend. First of all, when you're under 50, you can do less of a facelift. You can do a shorter scar. You can do it under local anesthesia in the office, and it's easier to maintain that look over the course of the next 30 to 40 to 50 to 60 years of your life than it is to reverse 40 years of aging in one procedure. So that is definitely trend number 3, is facelifts at a younger age. This is Dr. Heffelfinger with Jefferson Facial Plastics, and I gave you the top 3 trends in facelift surgery in the year 2013.